Well, you know, winter is coming, kind of, and the temperatures are getting cooler, but the common cold starts to make some more appearances this time of year. So when should you start giving your kids medicine, and what kind? Well, the WDSU's medical editor, Dr. Corey Hebert, is in the house to answer those questions. But first, let's talk about some of the newest recommendations released this week about spanking your child for discipline.
Yes, so this is groundbreaking, especially for the folks that are out there watching right now that are spanking their child every now and then. It's very important to understand that the American Academy of Pediatrics has come out with a new guideline to say that you should not spank your child at all. Now, when I say that, it doesn't mean that that you shouldn't discipline your child. It just means that you shouldn't spank them. And the reason why is because it is shown to be ineffective. All right. I mean, it's not that that you definitely can cause some physical problems after beating a child, obviously, but it just is shown to be ineffective. And verbal abuse as well is also highlighted in that policy statement. So if you're out there and you're spanking your kids, it's not working. And there's a study that showed that if you were a spanked child, that you literally can have an increased risk of dating violence on the opposite sex when you become a person that is dating that certain age. So it's just not a good thing to do. And I know we're out there, and I know we're causing a lot of problems out there by saying that, but you got to trust me, man. In my office, it is a touch-free, spank-free zone, and that's the reality.
I'm sure a lot of kids out there are happy about this new study.
Exactly.
All right, let's keep on the topic of kids, and
yes.
It's flu season. Talk about why it's kind of dangerous to give decongestants to children.
Yes, so there's a new study that came out very recently that showed that that once again, these decongestants don't work. For under the age of 6, decongestants don't work for children for the common cold. Now, if you have allergies or something like that, that's very different, where you would take Claritin or Zyrtec for your allergic rhinitis. But for a common cold that's caused by a virus, you should not take any decongestants, especially over the counter. And children under 2 years of age, it's very dangerous. They have increased heart rate, seizures, drowsiness, and maybe even death. So even though parents want to do something, man, they all want to do something when their child is sick. But you really can't do anything except nasal saline and give them some Tylenol or Motrin. Let them sleep, let them drink, and just move on. And don't hit them. Don't touch them. I'm coming to get you. Just don't touch it. Right?
He'll come to get you. If you want to come get more of this information, we'll have this on our website, WDSU.com. Doctor, thanks for joining us.
Thank you.